Traffic pollution leads to poor pregnancy outcomes. The environment of the mother decides the health of the baby in the womb is a well-known factor. Environmental pollution affects the growth and development of the baby, with lifelong implications for health. Exposure to environmental chemicals and stress in utero can lead to functional changes in tissues, and predispose the child to diseases that manifest later in life. Low birth weight baby is the marker of future ill health. Birth weight is inversely correlated with cardiovascular and metabolic diseases. Air pollution from road traffic is associated with low birth weight at term. The association between air pollution, pregnancy complications, and childhood illness is not new. By reducing exposure to air pollution from road traffic not only will improve the health of current adult populations, but reduce the non-communicable diseases in future generations too. Small particle pollution exposure in pregnancy has been linked to fetal growth, preterm birth, stillbirth, and respiratory morbidity in children. To avoid the harm from environmental air pollution, pregnant women should consider to reduce their risk of exposure. Air-filtering face masks reduce the risk, but there is no evidence that it reduces chronic exposures. They should change in walking routes, away from major roads and avoiding outdoor activity when air quality is at its poorest. This is not realistic for many pregnant women, owing to constraints from employment patterns, residential location, and transport options. Women are therefore dependent on policy change to reduce the risk to their unborn baby from air pollution, such as avoid highly polluting vehicles in urban areas. During 2008 Olympics in Beijing, air quality levels were improved by aggressive government interventions to cut vehicle emissions, and industrial production is an example to show this can be achieved with coordinated action. The immediate positive effects of such interventions were pronounced enough for improvements in population birth weight to be detected. The challenge is to maintain reductions in the congestion and implementing interventions to tackle diesel combustion emissions in urban areas. A global perspective reveals air pollution is a public health catastrophe. A recent Lancet Commission on Pollution and Health estimated that 16% of all premature deaths worldwide are owing to pollution, with 92% of pollution-related deaths occurring in low- and middle-income countries. In recent weeks, the city of Delhi, India has seen air quality reach levels that exceed established scales of measurement, with annual averages of fine particulate matter 50 times those of London. The pregnancy effects of extreme exposure environments like Delhi are unmeasured, and there is an urgent need to turn attention to such environments where large numbers are at considerable risk of harm. This study, published on the 5th of December 2017 in BMJ, increases the awareness that prenatal exposure to small particle air pollution is detrimental to the unborn child. Increasing awareness without solutions for risk reduction may serve only to increase maternal anxiety and guilt. Sarah J. Stock, MRC Centre for Reproductive Health, University of Edinburgh Queen's Medical Research Institute, UK, is the study author. Apart from avoiding tobacco smoke, clinicians should advise pregnant women to reduce their risk to exposure to traffic pollution. Multi-sector action is urgently required to tackle the problem of air pollution related to traffic, and minimize risks to the health of the next generation. Only policy makers have the power to protect women and unborn babies. Thank you.